12 before the top of the hour, y'all. We got the one and only Dr. MJ Collier on with us with our COVID-19 update. Dr. Collier, I was just in Atlanta, and you would have thought Freaknik was going on this past weekend, just to see how everybody was out. I saw people was not wearing masks and being safe. Dr. Collier, what is going on?
Not maintaining social distancing. It's like people are just totally and completely ignoring the guidelines now. You know, the weather was supposed to be bad in Atlanta. It was not. It was sunny and not too hot, so people were just out and about and doing what they're doing. So this is the problem. We now have 5.71 million cases after adding 36,500 yesterday, and the death count is now up to 177,000. We were just saying that we had reached 170 last week, and so we're consistently having about 1,000 deaths per day. And so this means that, the virus has not gone anywhere. Remember, people, nothing has changed. We still have no treatment. We still have no vaccine other than the time that has passed. And that's one of the reasons that the CDC has issued new guidelines for safe school reopening. They have now said add a mask to your school supply list no matter what school category you're in. If you're in elementary school, middle school, high school, or college, add a cloth mask, which is the preferred type for a school situation. It's a very important part of the mitigation strategies. And then when you can't maintain social distancing of at least 6 feet. Now in the elementary schools, middle schools, and high schools, they're saying you should wear them in the classroom, and you should also wear them during passing periods, i.e. between classes when the hallways are packed and you can't maintain social distancing, on the school bus going back and forth to school. And one of the things I hadn't thought about, Ricky, when carpooling, a lot of times families who aren't in the same social pod will carpool, and so you're bringing in the infection into the group. So they're recommending that you wear masks while carpooling as well. So, we are having some major issues to continue to have issues with this coronavirus.
Wow. All right, let's go to the phone. You're on with Dr. MJ Collier. Good morning.
Okay, the question is, what is the difference between a 30-minute result, your 3-hour result that you were talking about, and the results from that goes out 3 days?
Okay, the 3-hour result is as sensitive as the PCR nasal swab, and that was due to the new Saliva Select test, where they can get the results within 3 hours. The other testing, which may take up to 3 days, that's the PCR nasal swab, which is the gold standard for testing. The rapid tests don't have as high a sensitivity, and you can get false positives or false negatives, but more importantly, a false positive, which happened to the congressman last week. And then after he got retested with nasal swabs 3 times, they were all negative, and they thought and realized that his test was negative.
All right, you're on with Dr. MJ Collier. Good morning.
I hear everyone talking about being in quarantine, if we're quarantined and staying home. But if we're staying home, being in quarantine, what should we be doing as we're being quarantined?
I recommend highly doing immune system boosting, because if you've been exposed and you haven't been taking anything to boost your immune system, you should do that. Also, the person that's in quarantine should not expose other family members. As much as possible, try to isolate themselves into a separate bedroom, use a separate bathroom, and and don't take your food together with the family.
All right, y'all. Dr. MJ Collier, good morning.
Okay, I was tested positive. I was in the hospital, but I'm still having shortness of breath and a hard time breathing. How long does that last?
Okay, Ricky, they are creating a new category now that they're calling long haulers. The long hauler patients are people that are continue to manifest some type of symptom, and they have identified over 90 symptoms, but the top 15 have been those that people should take advantage of. They include everything from shortness of breath, persistent chest pain, to memory loss, and then difficulty with short-term memory, coughing, of course, and a variety of other symptoms that have not been associated predominantly with this respiratory virus. But those long hauler patients are really having symptoms due to complications of persistent inflammation, and they are more likely like chronic fatigue syndrome, which is also thought to be caused by a virus.
Right. All right, Dr. Collier, let everybody know how you can be reached.
I can be reached on all social media at Ask Dr. MJ. And remember, this Wednesday, 7 o'clock p.m., we'll be doing our Facebook Live, where you can call in and ask your healthcare questions. These are the opinions of Dr. MJ Collier, not those of the Rickey Smiley Morning Show or its radio affiliates. And we look forward to bringing you the coronavirus update every week.
This is the Rickey Smiley